This is Boomer Life on CL 650.
Well, Sonia really likes that one, that's for sure.
I do.
Change my mind. We're talking with our friends from Neurokinetics. Sonia Dale is the clinic manager down there. Philippe Silvestre is the founder and president of Neurokinetics in Vancouver. J.C. Gordon is director of liaison and logistics with Neurokinetics, which, by the way, is in the Highcroft Medical Building on Granville Street at 3195 Granville, and online anytime at Neurokinetics.com. We're talking about pain issues. And Dr. Philippe, I'd like to follow up on one thing that we talked about. I mentioned just briefly in a question form, the relationship between pain, chronic pain, and anxiety and fear. Because I suspect there's a little more to it than meets the eye initially, right?
Yes, it is the result of a process. Time is everything towards recovery, or also time is everything towards deterioration.
Right.
And the whole thing spreads like an old stain, if you will. It will be pernicious, it will be rampant, but at the end of the day, when this overwhelming pain will end up in crashing basically brain controls out of lack of cognitive processing, which is exhausted in a process in dealing with that very pain.
Right.
People crash. Patients crash. We crash.
And Sonia, you said that people actually, when they call up in fairly agitated emotional states.
Yes.
I mean, living with pain is no fun, especially when you've been living with it, as Philippe just mentioned, for a long period of time. The brain begins to compound anxieties and fears on top of the stress of the pain itself. And what do people tell you when they just try to describe what life is like these days?
It's I would say the main thing common that I hear from most patients out there is a fear of dying with pain. So it's a fear.
Right.
It's a fear of how long, will I even get better? How long do I have to live with this pain? Is it ever going to go away?
Right.
So just answering the questions they have, giving them the clarity, giving them the relief, and knowing that there is hope at the end of the day. Just simple thing of picking up the phone, giving us a call, sending us an email for 30 minutes to 45 minutes just to, get the answers to certain questions they may have, to help them provide a little bit of clarity, to help them maybe give them a little bit of hope that, yes, maybe there's something that can be done.
Yeah.
That's all it takes.
And JC, that's the word. That's the operative word, isn't it? Is hope.
Absolutely.
A lot of these people who come to Neurokinetics, boy, I'll tell you, they've seen a lot of doctors, they've seen a lot of medicine, and they haven't received a great deal of satisfaction in the process, and they're starting to run out of hope, frankly.
That's correct, Sterling. I hear it so often when I talk to people for the first time of, you mean I don't have to live the rest of my life with this pain?
Right.
And I answer that question for people by asking them the question, have you had pain your whole life? And if a person hasn't had pain their whole life, that is not genetically who they are.
Right, sure.
And so there's hope out there for you listeners. If you haven't had pain your whole life, you don't have to have it for the rest of your life either.
Let me use an example, because I'm just trying to relate to how this. Suppose I'm in a car accident and I get banged up and my back is sore and my neck is sore, and I've been to umpteen doctors and they've all told me they've had X-rays and CT scans, and I hurt all day, every day, and I have yet to meet a doctor in my experience since the car accident who has anything but, I mean, there's some sympathy, of course, but no ability to reach out to treat my pain. The prescriptions for mind-numbing painkillers, but no attempt to deal. So, Philippe, what do you do that's different from, say, a doctor who I would see I was in a car accident. I know you've convinced me by looking at the X-rays that I don't have a medical problem, but I'm in constant pain, doctor. I don't feel that I'm getting any better. So what do you do that the other doctors haven't been able to do?
The first thing I do, because I don't know what the others are doing, I can only talk about what I'm doing.
Okay.
And what I'm doing first is listening to the patient. The patient usually knows the best what they live with. And this is a very, very primary care I have is gathering and collecting very, very precisely everything they tell me.
Okay.
Even in distress, there are data and cues in what the patient will report. This beyond some discrepancies, beyond some glitches, beyond some excesses, which are always in a picture. There is a way, and that has been part of my training as a forensic investigator, to go beyond the lines and read between the lines.
And we were talking, Sonia, earlier during the break that I mentioned that I was going to use a car accident victim as an example. And you said, that's a really good choice because I talk to a lot of people who call Neurokinetics who have been in accidents, not necessarily car accidents, but some kind of traumatic accident type event from which they've never recovered.
Yes. Anywhere from sports to, car accidents to, now as weather is beautiful outside, people travel. A simple thing as even, bumping into something as they were traveling or injuring themselves, running away because they're running to catch their flight as they're running late. Simple things of, fallen somewhere, caused some sort of pain or has done something to trigger a previous pain that was never dealt with before.
Right.
We get a lot of patients that call me and said, you know what, I've had this when I was in the preteens or I've had this as a child. I've never addressed it because they said, you know what, it'll go away.
Right, you'll grow out of it.
You'll grow out of it.
Right,
It'll go away. You're a child, you don't know, you're just growing pains. You know what, it'll go away. Guess what, it doesn't.
Right.
Then, they're in now their 40s, their 50s, 60s, even 80s and 90s. Where pain hasn't actually gone away. It's actually gotten worse.
Well, and sometimes, Philippe, it's that, speaking of an experience in one's youth, maybe it was that skiing accident when you were 20. That your knee never really completely recovered, but, somebody said, oh, you'll grow out of it eventually. And so you've just adapted. You've changed your life to accommodate that irregularity. People do it all the time.
I would like to add a little comment there, which is extremely important. You mentioned an accident that has occurred 20 years earlier, ski accident with a torn ligament on the left knee, for example, and a few issues on the lower back, blah, 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 without concussion, to take a simple case.
Right.
And what people say, as you say, is, yes, things will get better spontaneously, trust your physiology, da-da-da, da-da-da.
Right.
Well, it is ignoring what we increasingly know now in state-of-the-art brain physiology and related neurosciences that after a given time, any peripheral ailment or symptom will become centralized and become a part of a brain's corrective strategy.
Oh. So your brain, so I was right. We change our lives to accommodate the injury and get on with it because we need to get on with our lives. So that's what the brain is doing. The brain is just adjusting to include this new weirdness,
so
right?
Exactly.
Sometimes it does, sometimes it doesn't.
Okay.
There's always a good reason for why you wouldn't be able to do so. And this is what we assess and look for.
So part of the intake process, and Sonia, you've done a wonderful job of describing this in previous shows. There's that initial phone call or email or Skype moment, perhaps, followed by a first interview. And it's not an assessment, it's just an interview.
Yes.
You come in and you have a half hour to an hour long conversation with a team member, and your profile gets worked up. Then there are a series of 3 assessments. Talk about those.
We go on, from the consultation stage, we usually ask, I must go back and just say, we usually ask them to bring a family member or a friend, or someone they feel is very supportive.
Okay.
With them going ahead and seeking help. So from that point on forward, we go on to a level 1 assessment, which is going ahead and starting the testing period of time, which is for 1 hour, understanding the severity of the situation or the condition, which then moves on to the level 2, which...
And this is on a separate day,
yes.
right? There are three assessment programs, and they take place on 3 different days.
Yes.
They can be three sequential days, right? Like Tuesday, Wednesday, Thursday, right?
We prefer to do it that way.
Okay.
Mind you, there are some patients, and I'm going to say this as well, 3 to 4 hours is a long long period of time, and we understand that.
Mm.
There are some people that come in, they're drained by the end of it because, they're not well. We understand that.
Right, and it's quite demanding.
It is.
Right.
So what we can also do, and we're happy to do on our end, to be as, supportive and make it as comfortable as possible, we're happy to divide the assessments up.
Okay.
So meaning if we need to
We
do,
can.
yes.
Sure.
So if we need to do half of it one day and do the other half the next day, we're happy to do that so they're comfortable and they're not, feeling that the 4 hours, by the time I'm there, I'm exhausted and I'm drained and I can't go home.
Right.
We're happy to do that for them as well.
Okay, and JC, this is all part of the customization that Neurokinetics can arrange for each person as they come in with their specific issues.
100% correct, Sterling. Everybody have different issues. Everybody need a different program. Once we are able to determine that we can help them, what the intensity and duration of their treatment is going to be,
Right.
they will have, Dr. Philippe will customize an individual treatment program
Right.
around their lifestyle that works best for them to move them from that incapacitation stage into the peak performance.
Right. It's all about possibilities, isn't it, Philippe?
Well, he ends up with a tangible restoration.
Exactly.
And performance.
A person back in the game again,
Yes.
right?
Yeah.
We all have, Sterling, we all have a limitless potential within us, and that's what we do at Neurokinetics. We measure that potential, and we make it a reality.
All right. Neurokinetics.com is the website. It's an excellent website, too.
Or renewme.ca.
Renewme.ca. Sonia's favorite back door into the corporate website is neurokinetics.com, or if you must, renewme.ca.
Yes.
Neurokinetics, by the way, in Vancouver, and the Highcroft Medical Building right there at 3195 Granville Street, and of course online at neurokinetics.com, okay, and renewme.ca.
Thank you.
This is Boomer Life on CIL 650. Our thanks to Philippe Silvestre, to Sonia Dale, and JC Gordon from Neurokinetics. And we'll see you next time right here on CIL 650.